Hello everyone. Today we are going to talk about persistent cough or chronic cough. So why you should not ignore a chronic or persistent cough. Any cough which lasts for more than 2 weeks is considered chronic or persistent cough. It could be something as innocuous as a dust allergy or sinusitis, or it could be a presentation of bronchial asthma, which is known as cough asthma. And in patients who are smoker or who have been exposed to chula smoke or to wood smoke can also have obstructive airway disease. So it could be something as serious as tuberculosis, which has not been diagnosed. It could be a fluid in your lungs, and it could be a side effect of medicines. So it is always a good idea not to ignore your cough, especially if it has lasted for more than 2 weeks. Thank you.